Today I'm going to be speaking with Sue Saltmarsh, the founding director of Demand Universal Healthcare. She'll be speaking about the difference between the Affordable Care Act and NEMA, National Improved Medicare for All. She will also talk about an upcoming event for business owners and how they can benefit from NEMA, no matter what size their business. Okay. So we talked a little bit about this over the phone, like the difference between single-payer universal health care and what right now everybody seems to be fighting for, which is the Affordable Care Act. Mm-hmm. Do you think you can explain it a little, just so the people that do view this show will get a sense or an idea of how single-payer universal health care is so much better than the ACA?
This has been part of our fight ever since the ACA was passed. The problem with it is that it was largely written by insurance company people who are obviously going to protect their own interests first. And as long as they're in the picture, profit will be their main interest. They don't really have that much to do with actual care, except for denying it in order to save money. Yes, they do cover people that haven't had insurance before, but the restrictions of the ACA in general, the narrow networks, the prior authorizations, the things that are covered and aren't covered, and things that count towards your deductible and don't count towards your deductible. Co-payments, co-insurance, all of that ends up costing the individual patient. And under National Improved Medicare for All, or single payer, there are no premiums, there are no deductibles, there are no co-pays. You have a card given to your parents when you're born, and whenever you need medical care, you go to the doctor you choose, or your parents choose if you're little, and the hospital that's the nearest and the most efficient, and you don't have to worry about, oh, I'm having a heart attack and I don't have prior authorization for an ambulance.
Right.
Mm-hmm. You get the care you need because it all comes out of a universal fund. Everybody pays in, everybody gets out of it. And a lot of people, I believe uniquely in this country, feel like, I shouldn't have to pay for somebody else's health care. But what they don't realize is that they're already paying for it. People who have no access at all, except the emergency room, are written off due to taxpayer money, subsidizing the hospitals. And if they had access to a doctor when their disease or condition or injury was easily treatable, it would cost way less than waiting until the cancer has spread throughout their whole body, or their broken leg has now got to be amputated, or the scenarios are endless. It, like many things in our political society, is a matter of foresight. And we have no foresight in this country. We can't see past the moment that we're in and maybe the moment following. But we don't see 5 years down the road, or like when they passed the ACA, very few people understood that it wasn't going to be implemented the way it was written. And of course, in the time it took to get it implemented to the point where it is now, and even now it's not complete, changes were made that made it less beneficial for the patient and more costly. So There are many ways in which National Improved Medicare for All, or NEMA as we like to call it, many ways in which it's better, more cost effective, more efficient. And for those who feel like it's a government takeover of healthcare, the fact is that it can be run as a semi autonomous utility. You know, it's a matter of one payer. The doctor sends the bill to the government pays the bill. There are no fights every day to get your medical care covered. You don't have the added stress on top of your disease or your injury.
Exactly, when you don't need more stress and more financial stress.
It becomes a matter of healing.
So we talked a little bit about this over the phone, like the difference between single-payer universal healthcare and what right now everybody seems to be fighting for, which is the Affordable Care Act.
Mm-hmm.
Do you think you can explain it a little, just so the people that do view this show will get a sense or an idea of how single-payer universal healthcare is so much better than the ACA?
This has been part of our fight ever since the ACA was passed. The problem with it is that it was largely written by insurance company people who are obviously going to protect their own interests first. And as long as they're in the picture, profit will be their main interest. They don't really have that much to do with actual care except for denying it in order to save money. Yes, they do cover people that haven't had insurance before, but the restrictions of the ACA in general, the narrow networks, the prior authorizations, the things that are covered and aren't covered, and things that count towards your deductible and don't count towards your deductible, co-payments, co-insurance, all of that ends up costing the individual patient. And under National Improved Medicare for All, or single payer, there are no premiums, there are no deductibles, there are no co-pays. You have a card given to your parents when you're born, and whenever you need medical care, you go to the doctor you choose, or your parents choose if you're little, and the hospital that's the nearest and the most efficient, and you don't have to worry about, you know, oh, I'm having a heart attack and I don't have prior authorization for an ambulance.
Right.
You get the care you need because it all comes out of a universal fund. Everybody pays in, everybody gets out of it. And a lot of people, I believe uniquely in this country, feel like, well, I shouldn't have to pay for somebody else's health care. But what they don't realize is that they're already paying for it. You know, people who have no access at all, except the emergency room, are written off due to taxpayer money, you know, subsidizing the hospitals. And if they had access to a doctor when their disease or condition or injury was easily treatable, it would cost way less than waiting until the cancer has spread throughout their whole body, or their broken leg has now got to be amputated, or, you know, the scenarios are endless. It, like many things in our political society, is a matter of foresight. And we have no foresight in this country. We can't see past the moment that we're in and maybe the moment following. But we don't see 5 years down the road, or like when they passed the ACA, very few people understood that it wasn't going to be implemented the way it was written. And of course, in the time it took to get it implemented to the point where it is now, and even now it's not complete, changes were made that made it less beneficial for the patient and more costly. So there are many ways in which National Improved Medicare for All, or NEMA as we like to call it, in many ways in which it's better, more cost effective, more efficient. And for those who feel like it's a government takeover of healthcare, the fact is that it can be run as a semi autonomous utility. You know, it's a matter of one payer. The doctor sends the bill to the government pays the bill. There are no fights every day to get your medical care covered. You don't have the added stress on top of your disease or your injury.
Exactly, when you don't need more stress and more financial stress.
It becomes a matter of healing.
It eliminates the middleman. That's simple. In fact, I think that's why it's such a good system. It's simple. Your taxes go to your doctor. Your taxes go to your health care. We've got insurance companies, they're for-profit, their CEOs make multi-million-dollar salaries. I don't know if you know the highest salary there is. I mean, they make multi-million-dollar salaries every year. So if you're thinking, okay, this is where some of our money's going for the overhead and all the paperwork and the approvals and having to get pre-approved and the doctors struggle to get paid, all that costs money. And I really think they should call it simple payer healthcare instead of single payer healthcare, because it's much simpler.
It is.
Simple for older people to understand and to deal with when they're sick, like you said, and they don't need the stress. So,
well, all you have to do is look at the actual legislation. The ACA is 4,000 pages and growing. HR 676, the Expanded and Improved Medicare for All Act, is 34 pages. And unlike most legislative language, anyone can read it and understand it. It's, like you said, simple and comprehensive at the same time. It's like it lays out everything that's covered, which is more than what's covered under the ACA or private insurance. Dental, vision, mental health care, physical rehab, addiction services, all of that is covered. The only thing that's not covered is elective cosmetic surgery. Your boob job will not be covered. And any experimental unproven treatment. There will be questions about that. But
and that's pretty much how it is in Europe and other countries that have it set up. And not that we couldn't set ours up a little different, whatever works best, but I think that sounds good. I mean, why wouldn't everything be covered? And what about, I think in Europe they do pay some for medications extra, don't they?
Well, it depends on the country. But the thing about it is that if we go to a single payer system, that means that everybody in the country becomes this huge purchasing block. So when the government goes to the pharma companies to negotiate prices, it's not just for Medicare or just for CHIP or just for the VA. It's for everybody. And there's really no other outlet except other countries for them to make obscene profits on. So the cost is going to be more realistic based on their actual research and development costs as opposed to the inflated ones we see today. And also, the negotiating power is ours, not theirs. So, as a business perspective, and our so-called president likes to identify himself as a deal maker. Well, there can be no better deal than to have all the negotiating power on your side and to really say, okay, this is what we will pay. And see that they really don't have a choice,
It's unsustainable. The
It
system we
is.
have is unsustainable. I mean, when I was campaigning for Bernie Sanders, he put out there, it saves the average family of four $4,000 a year. You don't need to know any more than that.
Right.
I mean, if you consider the insurance premiums that we're paying right now in insurance companies, it will save the average family of four $4,000 a year.
Yeah.
So you don't need to be a doctor. You don't need to be an economist. You don't need to be, have a degree in accounting to know that is all you really need to know. I
Right.
mean, because we can put that money back into the economy, purchasing other things, cars, a college education.
Covering other people for healthcare.
Yeah, right.
It's like it makes so much sense, but I also think that a uniquely American trait is that we immediately jump to, that sounds too good to be true, so it must not be true. Where's the catch? And so people don't think, unless they've lived in Canada or France or England, they don't think that it's possible. And maybe some of them don't even think they deserve it. But I do think we need to shift our mentality from, this is way too much for us, it'll never happen here, to every other developed nation in the world has some version of health care for all its people.
Yeah.
Why should we not? And really, the only thing that is standing in our way is the will to do it.
Well, I think a lot of it is the media, and it
Yes.
will put out there that people are paying for everyone else. You're paying for someone else when we turn to this horrible system that really, it's the insurance lobbyists that keep this going with Congress and not, they're afraid they won't be reelected.
Right.
If they try to change the system, but it's getting to the point where enough people know about single payer, they just might not be reelected if they don't bring up single payer.
And that's the tipping point.
And vote for it.
Yeah, if we get to the point where we are still standing up in town halls and yelling at them and not being happy with them and saying, I'm not voting for you anymore.
But most people this time around were yelling at them to save the Affordable Care Act.
Right.
That's the problem.
Yes, and that was a waste of time, but I'm really hoping that when they get back from the recess in August that Bernie's bill will be introduced.
Right.
It will be a real single-payer bill, and then we can really focus on getting the Senate to vote for it, or at least not vote it down like they did in the House. The House responded to people pressure, and I think the Republicans that stood up and said, no, I have too many constituents who are on Medicaid, or I have too many elderly constituents in my district, and that this would hurt them. Those Republicans are the ones that are going to get reelected. The ones who are like, everybody has to have more skin in the game. Well, I'm sorry, but some of us have been skinned. We have no more to give.
Right.
And they don't get that. They're so out of touch with the people they're supposed to represent that they don't understand why we don't have any more. It's been all taken from us, and in many different ways. You know, you look at the school bill here and the wage question and all the environmental stuff that's been destroyed and will now get even worse. It's like from every corner they're grabbing health and happiness away from us. And those are the people that need to go. They obviously do not have the best interests of their constituents at heart. So,
I mean, yeah, it's kind of one of those things when, I mean, Jimmy Carter calls it an oligarchy. I like a corporatocracy because it's a little more definitive, and that's just it. Like now we have fracking, we're going to have poisoned groundwater, things that make people sick, and then at the same time, under a corporatocracy, you have a system that doesn't heal people when it's the same system making them sick, and then you're denied health care once you get sick.
Yeah.
And so, but Bernie's single-payer universal health care was supposed to have been introduced last month. So is there a plan, like a date set up for
There's not a certain date, and I think, you know, that he's been trying to get to a point where he knew that he would have a certain amount of support within the Senate. The fact that Chuck Schumer went on the Sunday show and said single payer out loud is a really good sign. And we know that progressives like Elizabeth Warren and Keith Ellison and Tulsi Gabbard, although I believe she needs some more education on it, all of those people are going to be on his side. The ones we have to worry about are the corporate establishment, the Clinton people and the DNC, because they're still ignoring the fact that he's the most popular politician in the country.
Yeah.
And as long as they do that, you know, they're going to keep their people toeing the line, which, you know, I really hope that some of them get to the point where they just grow a spine and say, I can't do this anymore. I'm just sick of it, and I know what's right, and I'm going to do what's right. I mean, Claire McCaskill from Missouri, she should be one of those people, but she's been so scared of being primaried that she's going to get primaried. You know, it's like you said, they're going to be the ones that are not reelected. And then maybe the light bulb will go on a little too late, but who knows? I can't believe that so many of them seem to be totally oblivious to the reality of what's going on, you know, on the street.
So I know a lot of right-wing people, and the first thing they'll say is, oh, Canada, they have to wait in line forever, and a lot of those people die trying to get health care because their waiting lines are so long. What do you tell people like that?
Well, I first of all would recommend that they watch the healthcare movie. But my usual knee-jerk response is, oh, and you don't wait here?
Right.
Because I have to wait 6 weeks to see my primary care doctor.
Yeah.
In Canada, if you have an emergency, you are seen right away. If you have something that is either not emergent or ongoing, then you have the same kind of wait times that we have here.
Yeah, and I know what you're talking about. I saw that documentary too, and it's a documentary, and you can probably buy it online, and it's just simply called Healthcare. Right?
The healthcare movie.
The Healthcare movie. Okay,
Yeah.
very good.
It's narrated by Kiefer Sutherland.
Yeah, right.
And he's a Canadian citizen as well as an American. And it chronicles the history between the 40s, when we were both countries were sort of the same, to today, when, well, actually to 2009 when it first came out, to their single payer system and our mess. And it's a really good way to view it historically, because you see exactly where we split our ways.
Right.
And how easily we could have just continued the way they did and had our own single payer system.
Right. And if I remember right, there was a girl who went up there and she just biked around and asked people, would you like to change systems with us? Do you want the United States healthcare system, and we'll take yours? And they didn't say, oh no, we'll keep it, we like ours, it's a little better for this reason or that reason. I mean, this actually caused everyone to laugh.
Yes.
Out loud. That's how bad our system is.
Yes, indeed.
But it's laughable.
It is.
And that's what I remember the most about that. It's been quite a few years since I've seen that.
Yes, and there's this one scene where she was interviewing people about how they felt about their tax money going to pay for everyone else's health care. And there's this guy who's, big and ruddy and outdoorsy, who says, well, of course I want my taxes to go to that. Who wouldn't? And I think, oh, just look south.
Well, if not for that, for what? I mean,
Yeah.
what people need to know are our tax dollars go for perpetual war, ongoing, to kill and be killed for the profits of the elite few, where we go in and overturn democratic elected leaders,
Yeah.
and leaders about ready to become independent of the banking systems. And I don't think people realize that we're being screwed. It's not their money, it's our money. It should be used for us.
Yes.
For our road schools, for our health care.
I wish that somebody would propose a bill that allows us, when we pay our taxes, to say where we want it to go.
Yeah.
If
And
we
it
did
wouldn't be
that,
for
I
most
suspect the military budget would be way smaller than it is.
Because we have no business over there in any of these wars.
Yeah.
And Obama even said if we hadn't put all that money into the Iraq war, we could have converted this whole country to alternative energy.
Yeah.
100%. We'd be better off than Germany right now in that way. I'm to say, I was watching Tom Hartman the other day, and he announced that there is a large waiting list as far as people being concerned about waiting for health care. Like, he was referred 3 times. He needed some kind of surgery where he was actually in pain. And from the time it started and all the referrals he had to go through, he didn't get the surgery till like 6 months later.
Yeah.
And this was something where he was in pain that whole time, trying to do his talk show. And then my dad, he had a shoe that it had gotten damaged somehow, and this was a shoe for a foot that had a toe amputated because he's a diabetic, and it has another toe that was getting diabetic gangrene. And I think more than 6 months went by, because they had to do all this paperwork and everything wasn't just so, and for it to be covered, and then they never did get it right. They ended up giving him the shoe illegally, my dad said, before they even got the paperwork that needed to be done to give it to him for it to be covered. They just ended up giving it to him because they realized how ridiculous it was.
Well,
And
good
it was
for them
making
that they gave
his
it to
toe,
him.
yeah, it was making his toe worse that whole time.
Yeah.
So in ways, I think it's worse weight-wise. Do you agree with
Yes,
that?
I
With
do.
People you know and stories you've heard. I mean, if someone had a wound on their toe in Canada, they would get that shoe right away, wouldn't
Yeah.
they? That would count as one of the things they would get right away.
Yeah. We could be a happier, healthier, more productive society. And it filters down to every level and every person in our society. And I think, unfortunately, that's what the top 1% don't want. They don't want to be part of the whole. They want to be special.
Well, I think it's mainly the politicians we have wanting that lobbying money from the insurance companies, and that's what keeps us. And now, with Trump care, supposedly the elite would get a huge tax break from that system, and that was part of the corruption there, and that's what the media harped on. Just like they ignored the corruption with the insurance companies, it was all about Trump wanting to give himself a tax break, and that's how they twisted it to kind of muddy the waters there a little,
Well, and I think they're smart enough to know that with an approval rating in the basement, it's good business on their part to encourage people to be mad at him. And I'm not saying he doesn't deserve it. But if that's all they're going to concentrate on, then we're missing a whole world of information.
Because it's been going on all along. Mm-hmm. And they like to harp on that, on the evils of Trump, because I think it spikes their ratings.
Yes.
That's all they've got right now, because they don't report the news, that's for sure. I heard somebody on the radio here in Springfield the other day, and they were talking about how they think too many people will lose their job if we would just switch to single-payer universal healthcare.
Well,
and I was just wondering, what are your thoughts on that?
First of all, I have no sympathy for the United Healthcare CEO who makes $164 million a year, and who knows what he does for that.
164 million.
Yeah.
I mean, I just think people need to let that soak in for a minute. A year.
Yes.
Not a lifetime. A year. Okay.
I'm not sure that that's the exact amount, but I mean, there's a chart. I'm sure you've seen it, and you can see it on our Facebook page. Of what all of those CEOs make, and it's all over $100 million.
Yeah.
I mean, it's just ridiculous.
Yeah.
And really, I've worked for nonprofit organizations where the CEO was, of course, the most paid, while the little foot soldiers did most of the work.
Right.
And I'm sure that the same thing it is.
I mean, what is that? Is that like a half? Is that $250,000 a month, or what is
it's mind-blowing. Plus bonuses. Bonuses for what, I don't know. And they all have stock in the company, which will continue to go up as long as they continue to make profits. So, anyway, I can't even remember what I was saying.
I know, it's hard to think after that. But,
it is.
But
the people that will lose their jobs. This is the thing. This is what I always say to those. Well, what about all those people that work in the insurance industry? Those people have skills that the government will need.
Yes.
So they will be part of the implementation of the new system if they want to be. But also, they will be free to pursue their own businesses or their own dreams. There's a thing about opening the door to them for new employment opportunities that's sort of sarcastic. And I'm sure that there are many of them who will be pissed off and have trouble finding a job. But there will also be, I believe, the majority of them who will say, oh, thank God, I never have to tell a sobbing woman that her child's health care is no longer covered because they didn't pay the premium.
Yeah. Who wants to do that for a living?
Oh, you have to be heartless or numb in order to do that job. And plus, the way that they handle data, that's an employable skill that they have in many different areas. So I don't think that they will be suddenly an army of homeless people that don't have jobs and don't have hope. And for one thing, they'll all have health care.
Yeah. I mean, here's my thought on it. For the new system, anyone that works for an insurance company should have an insurance worker's preference, just like we have veterans' preference.
Right.
But also with that, and there probably are fewer jobs because there's fewer companies, and it would be, a simpler system. I mean, common sense tells me there would be maybe fewer jobs, not that many fewer, but at the same time this is implemented, what we really need is a federal environmental jobs program. If they implemented that at the same time they did universal health care, then those people could be retrained one way or the other. And I think along with miners and along with the oil industry workers, because our country needs to move forward, even if it means a lot of retraining and a lot of people don't lose their job but get shuffled around. I think our health is worth it and our planet's worth it.
Definitely.
But that's something that should be along with legislating universal single-payer health care, and that is that these people are preferred to be hired first and foremost, just like we do with the veterans here in Illinois.
Yeah. Well, I think that's a good idea.
Yeah.
And the CEOs can just go sailing off in their yachts.
Yeah, who cares what happens to the CEOs?
I mean, if they can squander over $100 million a year so that they're broke, then I'm sorry, they need some skin in the game.
Yeah. I mean, if you made that much in 1 year, I would just need 1 year and I would be set for life.
Yeah.
I wouldn't.
Yeah.
I mean, anybody would. So they should be set for life. I'm not worried about them.
No.
Because businesses struggle to find good coverage here, the way it is right now. But just to be clear, pretty much with universal single-payer health care, there is no business insurance because everyone's covered, and they just don't even have to worry about it. It's not even a department, or there's no one working to get insurance.
Right,
even.
Not from different companies. It would be like the payroll tax they pay for each employee now, only a little bit more. Right now, most businesses pay at least 10%, if not 20%, for their insurance coverage. And under HR 676, they would pay 4.75%, just like most people would. Come right out of your paycheck like Social Security and Medicare does now. We're going to need everybody to get this passed. And, of course, there are going to be people who want nothing to do with it and don't care, and that's fine. I can testify that it's never too late to start being an activist, although I sure do wish I'd done it earlier.
Me too.
But for the people who are just going along, like, say you just graduated from college and you're young and healthy and energetic and you think, I don't need health insurance. Well, I was that person too for 56 years. Never saw a doctor, just trusted my body to keep on chugging along. And then the breakdown happened. I was physically just drained from doing 3 jobs at once, and I couldn't go another step. And friends took me to the emergency room, and that's where this whole cycle started. So don't wait until you have to be carted to the emergency room. That was a major bill.
Yeah.
And don't believe it when they tell you, oh, you should go to a Catholic hospital. They do a lot of charity work. Because that woman with the clipboard is going to be at your bedside asking how you're going to pay for it the day after you remain conscious. So,
Yeah.
it's like, there is no,
Break.
oh, don't worry about this.
Yeah.
We got it covered.
Yeah.
So I think, even if you think it's not your fight, it will someday be your fight.
Yeah.
And-
So that's what got you into activism, your sickness itself,
Mhm.
really. See, what did it for me was 9/11, because I started just to myself asking questions like, why were we struck just out? It just seemed like out of the blue to me.
Mhm.
Well, it was out of the blue to a lot of people if you weren't paying attention
Right.
to what was going on in the world. So that kind of started getting me asking questions and trying to find the
Good.
answers, looking things up, and purchasing a book. It was called The Exception to the Rulers, which was written by Amy Goodman, and then from there I learned about free speech television.
Mhm.
But I really didn't get the whole picture of when I started watching free speech television to many years later when I could get satellite TV, because I didn't have a signal for a
Uh-huh.
long time until I moved, and I still remembered that book. And so I'm like you, I have a lot of regret about not knowing some of these things way sooner.
Mhm.
And just when I started watching free speech television, that kind of really brought me in a big way, because it was such a rude awakening for
Yeah,
me.
yeah.
So I think young people, no, it is your problem, and I do have a problem if they aren't asking questions as well.
Well, I think one of the things that has been conditioned out of us is curiosity.
Yeah, you let
Yeah.
someone else tell you what your opinion
Exactly.
is and what your comment
And
is.
unless you're curious enough to ask the questions that you want to know the answers to, you're never going to learn anything. And I just don't understand people who aren't curious. I've met a lot of people who are dedicated activists and dedicated practitioners, and they don't ask questions the way I would in their shoes. And I'm not going to judge them for that, but I have to wonder, how can you not be trapped in ideology if that's all you're taking in? You're never challenging it in your own head.
Yeah. And also following the money for everything.
Yeah.
For everything. Because that's where your answer lies. Isn't that a saying? Some kind of saying?
Definitely.
Something like that.
And these days, it's even more true than it was years ago when it was first said, I'm sure. I mean, it's like money is everything in this country, and it's just not. I'm sorry.
Yeah. And people are raised to believe that is success. That is the problem. I think.
Yeah.
Because it's not. Not the way I was raised, leaving the world a better place than you were born into it.
Right.
That's more like it. And you don't have to have a wonderful, high-paying job or material possessions to do that. That's
True.
for sure.
And I hope that There are enough people who are right now stuck in right-wing ideology who break free, and so we can all meet and agree it's a good thing that everybody has access to health care. There is nothing bad about that.
We're the richest country in the world.
Yeah.
We should have health care.
And I think maybe part of the reason that it was considered here is that there was that, and there still is to some degree, the panic about, we'll never be able to fund this. Really, it's been proven that if the government spent the same amount of money that it's spending now on the health care programs that it funds, as well as the cost to government employees and all of that, we could easily cover everybody. You know, and another argument that is often made on the right is that Medicare is broke. Well, Medicare is not broke. And the problem with it is that it's been rated by other governmental agencies, and
well, that's what people need to understand. It's our money that we put into for a lifetime.
Right.
So it's not broke, it's spent. Or like you said, rated, because how could it be any other way?
Right.
So people need to really, get angry about that instead of just thinking, oh, well, this is just how it happens to turn out, that it's broke. It's not broke, it's spent. Our money has been stolen, basically.
Right. And I hope that Bernie's bill will include some mechanism by which the rate that we pay in is increased over the years to match the economy, because that's one of the problems with the system we have now. We pay 1.75% of our income towards Medicare and Medicaid, and that was never changed. That's what it's been since 1960s something. I know it was just Medicare's birthday, but anyway, it hasn't been adjusted due to the economy that we're living in now. So, it should probably be 3%, which under 676, it would be 4.75 total. And I just, my income is $11,000 a year. And I would gladly pay 5% of that to see everybody in this country have the health care that they need.
Yeah.
And I don't understand people who make millions not being willing to do that.
Well, they don't pay their fair share of taxes all across the board. I mean, just in general. That's half the wealth of this country. Well, the 0.01% own as much wealth as the bottom 99% combined.
Right.
And that's, if they don't pay their fair share of taxes, that is our taxes.
Yep.
I mean, they own all the wealth. So, yeah.
As a child of the 60s, I remember having drills in elementary school. Getting under our desks because the Russian commies were coming, and the whole
Death and company.
misinformation, yes, the misinformation about socialism and communism and the conditioning that we all went through has people assuming that socialized medicine is a bad thing. Well, first of of all, we're not fighting for socialized medicine, although Great Britain has it and seems to do pretty well with it. The difference between what that is and what we want is that with socialized medicine, the government owns the hospitals, the facilities, and employs the providers. Here, hospitals and facilities are privately owned. The doctors are in private practice or with a medical group. They get to decide where they're going to work. The government has nothing to do with that. And that will stay the same. The only difference will be that they don't have to hire 30 people to bill thousands of insurance companies. All they need is one person entering in a code in the computer and sending it off. So that's where the administrative costs come in. They spend so much time and energy and money dealing with the people that deal with insurance companies. And they don't have to worry about that. They'll have actually more time to spend with their patients. And, I will admit, it's not even an admission, I'll just state, there will be a doctor shortage, definitely at first. And there's already a doctor shortage in terms of primary care docs because they make the least on the totem pole. But I think that there will be more who are willing to go into primary care if the fees are more balanced, and that's something that gets negotiated with the government every year under single payer. So you won't have doctors who won't take Medicaid patients because they don't get paid enough, and you won't have Medicaid. That's the thing that people don't understand in terms of government cost. Medicare, Medicaid, CHIP, the VA, TRICARE, all these different healthcare systems that the government pays into will be gone. They will be unnecessary. So that money also goes to covering everybody in the country.
So, yeah. Well,
I should mention the event that's coming up in October. We're going to invite Springfield area business folks to come to a screening of the movie Fix It, which was made by a Pennsylvania businessman. He owns a framing company, and he was really up against the challenge of how he was going to pay for his employees' health care. And he started to do some research and realized that the system that we have now was just impossible for him to afford. So he made this documentary, and it's really a wonderful tool to educate business people about the facts about single payer, and also to make several really good points. There is at one point a business owner in Canada who talks about how he would like to expand to the United States, but the only thing that's keeping him from doing that is the fact that he would have to pay way more to cover his employees.
yeah.
And for businesses that are small and family owned and sort of like a family in and of themselves, it can be devastating if one of their employees has a serious illness and they can't help. I have recently had some landscaping done, and my landscaper told me that they can't offer health insurance to their guys, but they pay from the coffers of the company any medical expense that comes up. And so far, they hire pretty healthy, strong guys to do digging and planting and all that stuff. But if one of them had some sort of catastrophic event, that would break the company.
Yeah, it would.
So we're hoping to have a lot of different business people come to the library. We're in the Carnegie Room on October 4th at 5:30. And a wonderful local organic farm, Willow City Farm, is going to team up with Chef Denise Perry, who will cater little finger foods for us with the products from Willow City, meat, cheese, eggs. I'm sure there will be some vegetables for the veggies. But I think it's going to be a really good evening, and we'll have a panel discussion afterwards. Right now, I'll be on it, and congressional candidate David Gill will be there. We're also looking for some business people from Springfield who have dealt with the insurance problem and would like to tell their story. So if you're a business person, put it on your calendar. We'll be sending out little notices on our Facebook page and on our website. So thanks for having me on the show.
You're welcome.